and welcome, welcome, welcome to Building Resiliency in Youth with author Kat McGrady from Boys Town Press. My name is Stephanie Emmerich, and I'm also from Boys Town Press, and I'm here tonight just to help kind of facilitate, do the housekeeping, watch the chat box. Hopefully, if anyone has any issues, let me know. I'll try to troubleshoot as much as possible. Before I introduce our fantastic presenter, I do want to do a couple housekeeping things to just let everybody know. We are recording, so we want you to listen and participate and chat. Don't worry about taking notes. You don't worry about writing this stuff down. We're recording it. We have a great packet we'll send out to you, and we want you to ask questions and really participate. So please use the chat box, and please make sure that you share with everyone so we can really see and talk to each other. And then finally, if anyone needs a certificate of attendance, just confirmation of your time, we will also send those out. So please know that you will get information from us after it's over, after we get the recording all ready to go and posted, and you'll have all the information from the slides, and we'll even include the chat and all of those types of things. So tonight you have joined us for Building Resiliency in Youth, and our presenter is Kat McGrady. She is an educator, a counselor, and a mental health therapist in addition to being an author. And currently, Kat is working in private practice as a therapist and parent coach. And she also, on top of that, serves as an adjunct professor for the Johns Hopkins University Masters in Education program, as well as being a doctoral advisor for the Johns Hopkins University School of Education. So she's got a lot of letters behind her name, and she has some fantastic information to share with us, and it's just, we really, really appreciate you being here. So Kat, I'm going to turn it over to you. I will keep watch of the chat box, so everyone keep communicating with us, and it's your show.
Well, thank you for the introduction there, Stephanie. Just to make sure you can see the presentation, right? Excellent. All right, we're off to a good start then. All right, hey everybody, thank you so much for coming. Like Stephanie said, I'm Kat McGrady, and we are going to talk about building resiliency in youth, and a little bit about self-care too. So before we get started, let's kind of go over what we're going to do with our hour together. We're going to, identify the main types of trauma. We're going to talk about possible impacts of trauma. We're going to discuss brain plasticity and its role in building resilience. We're going to identify the key elements of being a trauma-informed professional. We're going to
Kat, I'm going to jump in here, right? I'm apparently a very loud person, so I set the voice level bar high. So channel your inner loudness. I had somebody asking if you could just be a little bit louder.
Sure. Okay. Got the teacher voice. Get it from below. Okay. Yes. Glad you got that early. Thank you. Okay. So we're going to identify the key elements of being a trauma-informed professional. We're going to determine how you can help combat the impact of trauma in the youth that you work with. And we're going to, last but not least, because we understand how nearly impossible it is to leave work at the workplace and to not allow it to leak into your personal life and your own well-being, we're going to talk about, creating a foundational plan to alleviate and to avoid compassion fatigue. So, this is a place for connection and safety, and confidentiality and shared learning. So to that degree, please feel free to, like Stephanie said, leave questions in the chat, leave your thoughts. Please share your thoughts, your experiences, your ideas, any resources. We all love those. We all want to hear what you have to say. Grab something to sip or nibble on and just be comfortable and enjoy this time. So first, we're going to discuss trauma. Before we really get started, kind of take a minute to get your mind, ready for this. Reflect on the previous school year or just a previous year in general. And using the chat function, write a word, a sentence, a song lyric, maybe a quote, or just, enter an emoji or a symbol that embodies the impact of kind of the 2020, the 2021 school year and the year, politically, socially, health-wise, just everything, how it impacted your energy and maybe your efficacy. And then as you're going, I kind of view everybody else's responses too, and then sort of take a minute to reflect on what you notice. Give you a minute to do that. Good word. Another couple seconds before I move forward. By all means, as I'm talking, continue to add in and continue to reflect on what people are saying. I'm sure we're making a lot of connections here. So now that we've kind of thought about this last year and we're sort of in mindset, let's talk about the different types of trauma. There are three main types. The first is acute, and that is, it can be one or just a few events. They're generally short-lasting, short-lived. And those types of trauma can be, maybe a car accident or a natural disaster or bullying or theft. The next type is chronic, and chronic can happen, over multiple events. It can be prolonged. That type of trauma can happen over time, and it can be progressive. So some examples of chronic trauma include ongoing exposure to war-torn environments, maybe ongoing treatment of yourself or a loved one to illness, to an illness, or even domestic violence. And kind of in tune with that is the last kind, and that is complex trauma, which can again happen over multiple events. It can be prolonged over time. The difference between complex and chronic is that it starts at a young age, and it can impact one or more areas of development, and typically it's caused by trusted adults. So an example of complex trauma might be adverse childhood experiences, ACEs, which we're going to talk about a little bit later in the webinar. And trauma, which means that it happens directly to you, or trauma can be indirect, something like compassion fatigue. Maybe it's something that a youth saw on TV or heard on the news or heard from a friend or read in a book or something like that, where they heard about it, but it didn't directly impact. And as you were saying earlier, ACEs, adverse childhood experiences, most of the adverse childhood experiences was a large-scale 2-year study done in the 90s by Drs. Politi and Anda in alliance with Kaiser Permanente and the CDC. And through this kind of long-term study, what they found was that adverse childhood experiences related to abuse, household dysfunction, and neglect, mental health, risky behaviors in youth, and then kind of follow them through adulthood for the most part. Some of the increased mental health concerns, depression, relational challenges, increased physical health concerns such as heart disease, obesity, COPD, cancer, stroke, diabetes, STDs, and just a general decreased lifespan. And people who also took behaviors such as alcoholism, addiction, drug use, troubles at school, work absences. And studies suggest that those who have experienced one or more ACEs are 5 times more likely to have depression, 7 times more likely to be addicted to alcohol, 10 times more likely to use or become addicted to drugs, and 12 times more likely to attempt suicide. So in the bottom sort of left-hand side here, you see epigenomes. That sort of refers to the trauma response and adaptations. So there are studies out there that suggest that if a parent or even a grandparent experienced one or more of first childhood experience, their trauma response would be passed on to their important stuff to know. Talk a little bit about the impact of trauma. So trauma can impact cognitions, which can be, just for a second, processing. It can be information retention and making connections to new learning. Trauma can impact, it can create developmental delays or a decreased IQ, and it can impact executive functioning. Trauma can also impact the brain. It can increase cortisol and adrenaline levels. It can cause hyperarousal or even hypoarousal. It can cause excessive reactivity in the amygdala. I know our school district talks a lot about amygdala hijack, which means that, just the rush of the fear takes over and people can't really think correctly or use, their frontal cortex. It actually impacts the brain structure. It can be smaller, and it can trauma can cause social emotional activity in the brain. Emotional issues called social difficulty, common sense of self. It can cause difficulty with criticism or authority, and it can cause difficulty with emotional regulation. Trauma can also impact behavior. It can cause emotions and, cause trouble managing them. Again, with that emotional regulation and coping skills. It can create a lack of empathy, morality, and fairness. It can create difficulty with effective problem solving, and it can also create maladaptive coping mechanisms. Finally, it can impact physiologically. It can impact sleep, eating, and those daily habits that contribute to overall well-being. It can impair sensorimotor development. It can increase medical and somatic symptoms. And lastly, trauma can create, again, maladaptive coping mechanisms. So now that we kind of have a little bit of an understanding of trauma, the impact of it, the main portions of trauma, let's talk a little bit about becoming a trauma-informed professional. So the 3 keys to becoming a trauma-informed professional are thinking about the environment, relationships, and the emotional piece. So in terms of environment, that means the professional community, which includes awareness, ongoing education, and full stakeholder commitment. It involves safety, support, empowerment to grow, as well as to focus on your own self-care. It involves ongoing community and self-reflection and evaluation, thinking about ways that you can upgrade. It involves clarity of roles and methods, collaboration and partnership, and just sort of having a clear understanding of cultural implications and how to overcome cultural biases. And that includes, race, ethnicity, gender, LGBTQ+, but it also includes just individual culture. Like, what does a home life look like? What are some of those learned and used, and what use and training norms that are instilled in them? The next, relationship, building trust and safety. That kind of involves providing safety and comfort to the youth, being patient with as possible, getting to know the families that you work with in your community and attuning with your children and sort of their spheres of influence. It involves using humor whenever appropriate, having fun, and just sort of creating that welcome atmosphere, thinking outside the box and making things flexible, but also establishing clear routines and offering choices, establishing clear limits and providing logical consequences as opposed to punishments or praise without purpose or consistency. The relationship also involves not taking things personally, maintaining your cool and reflecting on kind of your own frustrated reactions versus thought out and beneficial responses. And then also avoiding re-traumatization. So you don't want to ask questions, that prod, you don't want to sort of bring about any triggers that youth might have. You want to plan to have supports in place if you feel like re-traumatization has occurred. And then this last piece is the emotional component, which is building on the strengths and using sort of a person's strengths-based approach when working with youth, strengthening self and child social skills and emotional intelligence, thinking outside the box and being creative. That goes along sort of the flexibility. And then just sort of meeting the child or adolescent kind of where they're at and allowing them to lead the way in that sense, giving them some autonomy and giving them some control and some power and just making sure you are where they need you to be. I'm going to give you a minute just to kind of look over what you may see in your professional setting. You may see, emotional, behavioral, or physical sort of looked for. So these are some things to pay attention to. You might see many of them. You might see just a few of them. But here's some things to kind of highlight and keep on your radar when you're working with youth. This could mean that they've had some trauma impact their lives. You're muted.
Darn it. I'm muted. Now can you hear me?
Yes.
Okay. Your audio is just kind of breaking out a little bit and it kind of goes in kind of little waves. So I just wanted to let you know, I don't know if it's a microphone or if it's the internet. I mean, sometimes these things just happen, but I just want to make sure, I don't know, just so you know.
I guess maybe give me like a thumbs up if it happens again.
Okay.
Thank you.
Yeah, I'll give you a little, if I'm giving you little hand signals, that's where you're cutting out a little bit. How about that?
Okay, thank you.
Yes.
So as you're reading this, you might be thinking about, somebody that you've worked with in the past or somebody that you presently are working with. Move on to the next piece. And again, you're going to be getting these slides in a couple days once we're done with this. So everything's going to be right there for you. Okay, so let's think about brain power now. Let's talk about brain plasticity. Awesome. Okay, so the brain's superpower is plasticity. It can regenerate, it can adapt and modify, and it can so science loves that. All brains are wired together, and neurons that fire apart wire apart. So this explains the idea behind neuroplasticity and trauma as well. So our brains create neural pathways when they fire simultaneously and consistently together, and a set of synapses essentially kind of things that allow you to autopilot when you're performing these tasks. So it's sort of like mastering the art of crafting your favorite sandwich or parallel parking. It takes practice, consistency, proper skill development, proper environment, proper thought patterns, and proper supports. But eventually, you can kind of do these things with your eyes closed. And the same goes for rewiring and repairing faulty pathways that have been damaged by trauma. So our brains can bounce back, by way of functional neuroplasticity. And that refers to the ability to transfer functions from one damaged part of the brain to a well-functioning region. And also through structural neuroplasticity, which refers to the brain's ability to kind of reorganize pathways and connections. So the structure of the brain actually changes. It's kind of like Waze. If there's a road blockage, it immediately sends you down another direction. Our brains kind of do the same thing. Pretty neat. Okay, so with that, let's kind of move on to resiliency. So take a quick moment. Think back to an overwhelming moment that you've had. Something kind of threw you for a big loop. And think about, was there an object or maybe a person that instantly brought some level of comfort or an understanding that whatever's happening, you're going to get through it? Share the object if you're comfortable with it. Share the object or the name of the person or the role of that person in your life by writing a quick description if you're comfortable doing so, kind of to get you, oh, that's just falling off, to give you an example. And when my brother was born, this was what Patrick, my older brother, got when he was born, a Scout. And Scout our family for like 40 years now, I think. But every single time my brother or my sister or my mom or my dad or I had a trying time, Scout would kind of magically appear in our rooms to remind us that we're going to get through it. We're okay. Like, we've got this. And when my brother went to college, he gave Scout to me. So now whenever anybody in my family is going through something trying, I send them a picture of Scout. We mail them back and forth. So this represents resiliency in my family. If you want to keep on adding to the chat, please do so. I'm going to move forward, but by all means, keep on. As for doing this, think about what resiliency means to you. What is your definition of resiliency? Do you think it's an inherent trait, or do you think that it's a skill that you can build on? Or, maybe you have some examples of people or events that demonstrate resiliency in your life. Maybe you have a few symbols that represent resiliency to you. Maybe there's colors, shapes, sounds, smells. What sort of other representations just sort of encapsulate resiliency in your own mind? And if you want to share those in the chat as well, you can, or you can just think them in your head. But anything that kind of comes to mind. I take a minute to thank everybody for sharing too. Your great ideas. So you can set the stage for providing a path to resiliency. You can do this by giving gratitude and growth opportunities moments, by providing awareness, positive thinking, connection and contribution, and acceptance and meaning making. I do love all of these different pieces that people are bringing up. I like the weeble wobble too. And health and wellness, and safety and support, choice and control. Okay, so let's discuss. We're going to talk about some different sort of zones of resiliency now. And then afterwards, we can maybe share some strategies and techniques that we can think of to promote each one. So the first is health. And what I mean by health is physical, mental, emotional, and sort of hygiene health too. So, that could be sort of physical in terms of, healthy eating habits, or establishing, a fun sort of way to get moving, or a mental, emotional health, exploring relaxation strategies or regulation strategies, or, promoting humor, flexible thinking, and just laughing and encouraging the challenging of negative thinking. And hygiene, it's just sort of, creating a daily routine and establishing maybe good sleeping habits. Those could be some ideas for strategies or techniques. Another zone is self-awareness. And you can sort of promote that by using strategies related to, modeling mindful moments, creating maybe like a daily mood or a thoughts tracker, and practicing grounding techniques. It's always a good way to become aware of self and everything around you. Another kind of zone to think about is connection. And that's just sort of like promoting positive interactions, teamwork, inviting children and teens to join clubs, to join teams or different organizations, just becoming a part of their community. The next zone is contribution. That's, volunteering or using somebody's talents and passion, strengths to help. It could also be just having discussions surrounding sort of values and morals and how to make good choices, contribute to society. The next would be self-acceptance. You could kind of promote that by creating and using mantras, by exploring positive journaling, sort of exploring different positive strength-based kind of activities, and just sort of making time for opportunities to promote social skills. Last one would be grit, and that, some ideas for that could be setting goals and tracking them, making sure that you reach them, and taking different paths to get there if you're not quite there yet. Giving you a sense of purpose, and just sort of seeking new experiences and opportunities, like healthy risk-taking, taking on challenges. Take a minute and think about all those different sort of areas of resilience. And are there any ideas that you can think of that could promote any of these different zones? And if you can, please feel free to add them into the chat. We'd all love to hear. Or if you have used any of these in the past, maybe you could talk about that too. Kind of as you're thinking, please feel free to keep on adding. But kind of move on to the next slide. So thinking about individualizing resiliency-based support, you want to kind of focus on these different considerations: personality, traits, and strengths. So when you're thinking about the individual child or teen that you're working with, what is their personality? Are they an introvert, an extrovert, an ambivert? What are their traits? And what sort of strengths do they have? What are their hobbies? What are their likes? What are their interests? What are some things that you know you can kind of engage them with and that they're comfortable with? Again, think about their comfort level. If they prefer to kind of keep to themselves, maybe they wouldn't be comfortable doing something in front of a large group. If they like to kind of act out, maybe they wouldn't be comfortable sort of looking inwards right away. So think about what their comfort level is and make sure that you're in tune with that. Their developmental level. So you don't want to give the child or a teen something that's, a little above their developmental level or even really below it. You want to get them right where they're at, meet them exactly where they need to be met. And just sort of think about your personal strengths and skills and qualifications. If you're not comfortable with something, then you by all means don't have to do it. Think about the things that you are comfortable with. Think about the ways that you can help and the things that you're confident in helping with. Like, oh, I'm good at this. I can help in this way. Having those conversations and just sort of figuring out how you can meet each other where you need to be met to increase resilience. So one thing that we talk about, this is like also a piece from the book too, is sort of there are 6 areas that we focus on in terms of, coping for resilience. And the first is releasing energy, especially in those moments where, the youth might be feeling really angry or really sad or just those big emotions. They need to release. They can go and then process what they're feeling, maybe why they're feeling it. They can calm down, they can ground themselves. They can also increase their confidence and positivity and sense of self for long-term sort of coping skills. Reduce their own anxiety, in the present and long-term too, thinking about coping skills for that. And then releasing negative feelings, which is a big piece too. So in terms of those skills, some examples of releasing energy might be just sort of, ripping up paper or chewing gum, chewing on an apple. Might be jumping rope really hard or singing as loudly as they can to like a some of the kids that I work with like to fill a sink with cold water and kind of splash their face around in it because that sort of gives them that jolt to release the energy. The next processing could be maybe drawing your emotions. What does your emotion look like? What color is your emotion? What shape is your emotion right now? Or emotions, because we oftentimes have more than one. Listening to songs that resonate, creating your own playlist that kind of goes along with what you're feeling. Some lyrics or just the sounds. Writing a song or a poem to kind of process and get out what you need to get out. And this also for kind of younger kids is a good time for bibliotherapy because they can process what's going on outside of their own body. They can see it in somebody else and have empathy and make those connections. So it's a good time for that too. Good time for boys to have books. Focus, grounding, and calming. Some ideas for that could be, creating mandalas or Zen tangles, purposeful breathing. There's so many different breathing and mindfulness exercises and apps for that. Sensory exploration. A lot of the youth and teens that I work with really calm and ground just by feeling, smelling, tasting, touching, using their senses. Or practicing yoga, light movement exercises just to kind of get the body in tune with sort of, somebody had put ocean waves, the sounds of that and heartbeat earlier. That's calming and grounding as well in terms of frequency. Some ideas for confidence and positivity can be sort of like tapping or emotional freedom technique. Telling yourself mantras, giving people mantras or having them create their own that they can then tell themselves. Creating something, even just having like a creative project or building a vision board to think about the future and what could be. And some anxiety reduction strategies could be reflexology, practicing those different hand pressure techniques, challenging negative thoughts. And then finally, the release of negative feelings. A lot of people just laugh. Have you heard of like laughing yoga to release the negative feelings? calling a friend or somebody that you love that you know is going to support you, make you feel better, doing some exercise or trying to do something goofy or even try a new skill can help you release negative feelings, taking positive. And now that we've got some ideas about resiliency, brain plasticity, trauma, let's talk about you. Let's talk about compassion fatigue. We all know that feeling, especially now working with you, it's really not that deep into our lives. So first take a minute and think about compassion fatigue. So the definition of compassion fatigue is it can be emotional or spiritual exhaustion that leads over why being. So it's often confused for burnout, but some symptoms can be physically. You can feel ill frequently. You can have dysregulated sleep patterns or just a severe lack of energy. You could feel weak and tired, and you can have a lack of appetite or eat a little normal. Psychological symptoms could be feelings of despair or loss of control, excessive self-concern, or stagnation. And some social symptoms are just a lack of connection. You feel like you don't connect with anybody, a lack of desire to connect with anybody or to go out, withdrawal. Maybe you feel empty or lonely inside, and just sort of feeling rejected as well can be a symptom. So ways to kind of combat compassion fatigue are through awareness and by focusing on your impacting our body, physically, emotionally, and if all these are aligned or misaligned your core values. So really doing some turning inwards and doing some critical self-reflection. What's going on in me? Why is this happening? You can also,
Kat,
yeah.
It's me again. Just jumping in. So you were doing it was going really good for a while. Now it seems like it's breaking up again. Do you want to try just stopping your video feed and see if maybe that's where the lag is, just for a little bit of the presentation, to see if that makes a difference?
Sure.
Okay. It's that little box down there of where it's probably on the lower part of your screen where you can stop your video, turn it on and off. So maybe that'll help a little bit.
Kind of, let me see if I know how to, it's showing me a different thing.
Okay.
Oh, wait, got it. Okay.
Okay.
Okay, hopefully this works. Thank you.
Yeah, we'll see. And then we can see if that helps.
All right. So, okay, that compassion fatigue is with balance. And you can do that by kind of focusing on the areas of wellness, focusing on physical balance, exercise, yoga, movement, focusing on spiritual, leisure, making sure that you have time for leisure, making sure that you have hobbies, you have time to kind of relax, and as the kids that I work with would say, chillax. Just sort of hang out, give yourself that time, allow yourself that time. Balance by focusing on relationships, your family relationships, your social relationships, and giving them time to be nourished. Focusing on your personal growth. We talked about, trying new skills with the kids that you work with. Maybe you want to try a new skill, or maybe there's something that you want to enhance in your life. Mom's doing stained glass right now, so it could really be anything. Focusing on your emotional health and your intellectual health, just keeping yourself going in the areas that are meant for you. Okay? And then the last way to combat is with connection. So that's building and maintaining valuable and supportive relationships. And that can be with family and loved ones, with friends, with coworkers, with the groups and teams and community that you work with. Maybe you want to join, like a softball team or a kickball team within your community, just something fun. So with that in mind, let's create some personal plans for wellness. So Think about these three areas: awareness, balance, and connection. And take a minute and kind of make this promise to yourself. To increase my awareness, I will commit to. And some ideas would be just sort of committing to identifying the triggers that lead to negative thoughts, feelings, or actions. Maybe it's recognizing the physical, emotional, and behavioral response that you have to triggers, or understanding personal vulnerabilities, biases, and how they may impact your reaction. Maybe it's being cognizant of irrational beliefs that may arise and try to kind of counter them. Maybe it's using I messages for yourself, clearly stating your needs and being assertive. And developing realistic expectations for yourself and for others. As you're thinking about those different pieces, also think about to find and maintain balance. I will commit to. And you can think about different things like practicing mindfulness and being in the present, maybe getting one of those apps and just doing it in the car on the way to work. Using grounding techniques. Understanding your locus of control, what is and out of your control, and accept what you cannot control. Maybe it's setting boundaries for yourself and for others, delegating tasks and asking for help, accepting help when you feel overloaded. I know that can be kind of tough for us, but it's important. Practicing healthy sleeping, eating, and hygiene habits, making regular visits to your doctors, and practicing gratitude daily. Oops. The last one is just sort of to maintain connection. What can you commit to? And that might be establishing a strong support net at home, at work, and in other areas of your life. Making the effort to establish and maintain diverse, positive relationships. Joining community teams or leagues. Going to different events in your community. Maybe it's taking a vacation or establishing family routines and time for togetherness. Or it could be communicating openly and honestly, not passing judgment of yourself or others, and seeking to understand varying frames of understanding. So since we have this time right now, before we move on, let's take a minute and think about all three of those. And if you'd like to, maybe you can share in the chat box what each of you might be committing to, at least to one of these areas. Something that you will commit to for yourself. As you're doing this and as you're thinking and reflecting, I am kind of looking at the time. I know you're probably tired, so please keep adding to the chat box. Please keep thinking about this. But as you're thinking, I'm going to move on to the kind of one of the final pieces here. It's actually one of those TEDx talks. It's from Vicki Kelly. It's called The Paradox of Trauma-Informed Care. It's pretty interesting. So as you're listening to this, think about your commitments to yourself and how you're going to combat passion fatigue with awareness, balance, and connection. I'll come back in a second. Just sign for further. You can find more in Building Resiliency in Youth. I'm sorry that the audio wasn't working that well tonight. I am glad to know that you're going to get the slides and the notes afterwards, though. That's important stuff.
Well, and you know, Kat, it's very interesting of where even though when it's very spotty when we're watching it, somehow the recording kind of pulls it all together. So for all of you who are here and watching it and that type of thing, somehow, I don't know, with the way WebEx, it picks up the audio and kind of fixes it. So I think the final product should be good. But we definitely want to take some time for everyone to ask questions in the chat box. Kat, if you want to turn your video on again, it might help to, since you're, oh, there we go. Since we're not having the the video, the PowerPoint going too, that might help too with the bandwidth. Would you stop it? See, I told you she'd be singing to us by the time that it happened. Yeah.
Perfect.
But as people are typing in their questions, I do want for you to give an opportunity to talk about your book series, the Building Resiliency in Youth Toolkit. So can you tell us a little bit more, tell everyone a little bit more about the 3 pieces in that, and please, and then we'll get some of the questions in the chat box. They'll give people time to type.
That's exactly, okay, certainly. So it's 3 different books, the Building Resiliency and Youth Toolkit. There is the main sort of guidebook, the Building Resiliency in Youth, which is, a trauma-informed guide for working with youth in schools and different professional settings. And that involves, the snippets that we had today, they're dug into a lot deeper in that book. We talk about ways to present this to your school and ways to, reach people who don't want to be reached as well. And how to reach out to the community. We talk about ways to bring this into professional development and how to make sure that it maintains its integrity within professional development. It doesn't just sort of drop off, which kind of tends to happen. Using different models and how to use it as a leader. We talk about in the Building Resiliency in Children. That's kind of an activity guide for children. It involves, I think there's like 36 different activities that you can do that touch on each of those 6 SNAP skills that we talked about for coping and building resilience. There's activities for each one. They all can be kind of fixed and sort of like worked with and edited to meet individual needs. It also has a children's resource that has in teens, sort of a self-guided workbook for teens. See and start thinking about this. So that's one. And then in the Building Resilience, also be flexible to use. It also touches on those 6 skills. It's got just a series of these that can also meet needs and to meet sort of personalities and traits and developmental. So it's, they're all a way to build resiliency and grit, to build confidence and self-awareness, to a way to kind of combat everything kind of going on in their lives. Any type of trauma that's happening, and ways to self-reflect, ways to cope, and it could all be done and with various traits, various personalities, various levels.
Great. It's okay, we've got a couple questions. So for everyone who has joined us, this toolkit is available now, and it is a great resource. But I want to make sure that in the last 10 minutes that we also have a little time to answer some of the questions. So we have one that says, what do you do to help students who do not want or are afraid of being helped?
That's kind of something that I've run across as well. And a lot of times I do find that, they sort of, for those who don't want to be helped or are afraid to kind of go, it's also a personality thing. If you can, of course, building those relationships is a huge piece, but there might be somebody else in your professional setting who they might be more willing to talk to. Maybe they're more willing to talk if they have somebody with them, friend, or even not talking. If you could get them to sort of, some of the activities in our teens and children's books are for getting sort of thoughts on paper and getting to the point where they recognize that they want help and that help can be beneficial, but it's done in a way that's, through music, through a nonverbal, or through some sort of mindset, through movement, just different ways to get to the point where they want to get help. And building and maintaining the relationship is very huge. So understanding kind of their background, their personality. Do they like humor? Do they like somebody who's sort of like soft and kind? Like sort of figuring out what they need in there and not pushing it. Just sort of maintaining the relationship, being available and letting that you're there, but not pushing until they get to the point where they kind of show you the nonverbals that they're ready. And just sort of asking open-ended questions. That it takes time, but eventually it works because you have that relationship and that trust.
Okay, I'm going to kind of go in these little orders because I think one will be a quicker answer than another. So what is an antrovert? You said introvert,
Ambivert.
extrovert, okay.
It's kind of like ambidextrous. It's like you kind of bounce in between introvert and extrovert. You're kind of in the middle. Sometimes
Okay, that makes sense. Yeah.
some people
So ambivert. Okay. Okay, so I think, let's see. So you were cutting out a little bit more in the question. So maybe we want to stop sharing your screen too, because that might help.
Okay.
Because we got a couple, and then if so, we might have to go back to stop sharing the PowerPoint screen, and maybe just we go to just having you talk to answer the questions.
Okay.
And we want to see if that helps a little bit. And okay, another question. Could you talk a bit more about, I'm not going to pronounce this right, epigenomes?
Oh, epigenomes. Sure. There's a lot of
Epigenomes.
Yeah, yes. There's studies that are still out there, but based on what they've seen, it shows that, it does, from what I've seen, the research that I've seen has gone back generations, grandparents. But if a grandparent or a parent has experienced any type of trauma, any of the adverse trauma experiences, or the way that any maladaptive coping mechanisms that they've sort of, taken on based on a trauma that they've experienced, they can pass those down to future generations. So even if a youth now hasn't experienced some sort of trauma, they might have anxious tendencies or anxious attachments. They might have some depressive symptoms or something that comes from the trauma of generations before. It's really interesting stuff. There's not that much research out there yet. I think that it's kind of up and coming. The stuff that I've seen has been more recent, in the 2000s, but it's interesting. Definitely look into it.
That is very interesting. Okay, a couple other questions. How do you get youth to take a risk to get help?
That's a good way to put it. Taking a risk to get help, because especially at particular ages, they don't really want the help. They want to kind of turn it inwards. They don't want people to know their own business. So it absolutely is a risk. That's a good word to use. And it's like we were saying earlier, building that relationship or getting them to do it in a communal setting. There's a lot of adolescents that I work with that would very much prefer working in sort of like a collaborative setting, like working with kids their age in, discussion circles where maybe there's an adult there facilitating or prompting with questions, but a lot of times they want to start with a friend or with people that they know they can connect with, and not having somebody there that's going to kind of, tell them what to do or expect things of them. They might feel judged or they might feel overwhelmed by that. But if they can just have discussions with people on the same playing field as them, then that really tends to open them up to more. That would be kind of my first place to go with that.
Yeah, that's a great tip. Let's see here. Okay, so going to the books of is the Building Resiliency in Children book appropriate for school counselors or more for a therapeutic setting?
Actually, more for both. As a school counselor and as a private therapist, I've used these activities or things very similar to them in both settings. But that's kind of what they're built for. They're built for all professional settings. It's more geared towards schools, but it's also meant for other therapeutic settings.
Yeah, it is a very versatile, you've put together a toolkit that really is versatile for all types of settings. So when and it's more for the audience and not necessarily the setting. So when you think about the overall, the main book provides so much great information, and then you have the specific building resiliency in children, building resiliency in teens that can work in that area. So yeah, it is very, very flexible in that way. Another question, do students who have experienced one of the 3 different types of trauma need different types of help than students who have experienced another one?
Actually, a really good question. And It really depends on the individual. Like it depends on sort of the lens that they're viewing it from, maybe their background, sort of their inherent resiliency versus what they've also learned, some coping skills that they have, and just their mindset as well. It could be, I mean, there are so many different types of trauma, and especially in the past few years, there are so many different types that any child or adolescent can experience. And just sort of the way that you go about guiding them and supporting them really is based on kind of their individual level, where they're at, developmentally, where their mindset is, what triggers them, and how they respond kind of inherently. And you go from there. And it really, I mean, one child might view what's something traumatic, like maybe a car accident, very differently than another child. One might just carry that with them for years and let that sort of build up and spiral. And one might think, oh, that was an adventure, moving on. So it really depends on the child and sort of their own mindset. More
Well,
so
and
because of trauma, oftentimes.
Well, and even siblings, they might have experienced the same event, and for one child it's traumatic, and for the, like you said, I mean, even that close. And so where it's not just different children, but even children in the same families that have had the same experiences would have different types. So I think that's the thing of where one of the biggest takeaways I've got from your webinar and your talking tonight and going through is the individualization and finding, and like you said, meeting kids where they're at.
Absolutely.
Yeah, great. Let's see. I don't think we have any other questions. I think we got through all of them, but we'll make sure if you have any more, please put them in the chat box. And we appreciate everyone's attendance tonight. And going through, we all had to use a little resiliency ourselves with with some internet and all of that kind of things. But I hope everyone had some good takeaways. And Kat, thank you so much for your time and everyone who has participated and your talents. I mean, that's one of the things too of everyone who is here. I hope you know, and please check out the book series, and there will be more to come from Kat, and we will send out the recording and all of the information so you can review it again. And Kat is so wonderful too. We will if you have questions for her, anything like that with following up, let us know. This has been a great opportunity. We enjoyed trying to have an evening type of time to give some flexibility for people, because schedules are not great. Schedules are difficult, and so flexibility is great. So thank you so much, and Kat, thank you so much.
Oh, thank you, and thank you everybody for coming. This has been a lot of fun.